we did talk about where we start. You've also thought about it.
Yeah.
And you had mentioned starting with that first moment.
No, I'd actually like to start with the worst moment.
With the worst moment?
Yeah, which was this summer with the young male doctor doing the ultra and me and him realizing that there is something that doesn't belong there.
Okay.
That's the worst moment now. It's not the first experience.
So, what image represents the worst part?
The one where I'm being examined this summer, and he's doing the ultra, and sorry.
Yeah, take it.
And we notice it, the thing that he uses. We notice it moving, as a, in a way that you I feel inside, and I can, feel that there's a grape, or if I would call it a grape, there's a grape in my breast, in the healthy breast. And him kind of like, freezing, and me freezing. I think we both freezed in that situation.
And what words go with this image that would express your negative belief about yourself now?
Hold on. Or wait. It will be like, this is it. I'm dying. I'm, having my third cancer. There's nothing I can do.
Okay, so it's like I'm dying, I'm powerless.
Oh yeah, definitely. Yeah.
I'm dying,
Yeah.
I'm powerless.
Yeah.
All right.
Because I've always thought that, if I may continue a bit, is that the critical thing about cancer, as everybody knows, is whether it's spread or not. And I think that when you have the discovery that it's not, you kind of like win in a lottery, because it's just so much a matter of luck also. Having won 2 times in a lottery, I could never think that I could win 3 times. And that's why it's been like always, okay, having 2 different cancers, when the third one comes, I won't cope with that, and I won't survive from that. For some reason, I think like that, because thinking of the odds, basically.
Okay, so I hear you. I'm dying, I'm powerless.
Yeah.
Now let's talk about a therapeutic goal for processing this memory. What would you rather be thinking? What would you rather believe about yourself?
Well, I survived.
I survived. Okay. Now, when you bring up this image, the doctor, how true do the words "I survived" feel to you
1
now?
or 0? I know your scale.
Well, yeah, 1 to
I'm sorry.
7, 1 to 0. I hear you.
Yeah.
And when you bring up this image and the words, I'm dying, I'm powerless, what are the emotions right now?
Fear, panic in a way.
And how disturbing is this right now? 0 to 10, 0 calm, 10 the worst.
9.
And where do you feel this in your body?
Everywhere.
Okay.
I was just shaking and,
Shaking
crying
and everywhere, crying everywhere. And where,
Yeah.
is there any place that it's the most? I know it's right here. Great.
Difficulties in breathing.
So, are you ready? Bring up that image. Those words, I'm dying, I'm powerless. And notice those sensations. Yeah, that's right. Good. Take a breath.
Yeah. There's kind of like these, cold things going in my body.
Okay, yeah.
interesting. The shaking and feeling cold suddenly. I was trying to think whether that's something that I remember from the chemo treatment. I have a bit difficulties in holding on the image because I was concentrating on my body reactions, and I think I remember having a symptom after the chemo of freezing.
So let's just go with that. Don't hold on to anything.
Can I have? Yeah. Again,
Okay.
not anything more adding to that.
It's more comfortable now as you think of the sun.
Yeah.
Okay. Okay, good. So now let's go back to the memory we started with the doctor.
Yeah.
And what do you notice now?
It's just it's kind of like it's gone more similar to the ones that I have, from other memories, from the doctor calling me, and so I don't notice anything that would jump apart from those in terms of of emotions or bodily sensations. I'm laughing because my own doctor told me, and I hear the voices, that it must be someone who's really panicked from your history and who doesn't have much experience with cancer patients. The doctor because I remember him, really backing up in the situation, really literally backing up, and I see him wanting to hide to the other room, I want that patient out of this room because I can't handle this in a way. And I'm there, help me. And now it seems a bit humorous in a way. And I see myself thinking that I'm sorry for him on putting him for that situation, and I hope he's doing okay, and I hope he learned from somewhere that I'm doing okay now. Yeah, nothing really more.
Okay, so now when you go back and you think of this memory with the doctor, how disturbing is it, 0 to 10?
0.
Okay,
Yeah.
it's just less.
I found myself thinking, did I answer you too rapidly? The 0, but then, double checking it. Yeah, it's a
0.
It's a 0, yeah.
So do the words "I survived"
Yeah.
fit, or are there other words that may be more suitable now? Can you think of this memory?
No, it's definitely a survived. But then I start thinking whether, it's not necessarily only that I survived. It's more or less, I survived, and then I'm stronger when it comes to cancer. after this. And I'm again stronger because it's like, repeatedly getting stronger when you have this experience.
So I survived and I'm stronger.
Yeah.
And when you bring up this memory.
One more thing, I
Yes.
think I need to add,
Mm-hmm.
it's important for me to add the I'm stronger because going to the genetic examination, it's not enough for me to think only that I survived because I need the mechanism to
Yes.
face the situations there that come.
I'm stronger. It's important. I
Yeah, so I'm
survived
kind of
and
like
I'm
coping
stronger.
myself in advance for that situation by thinking that I survived and I'm stronger.
Okay, yes, I survived and I'm stronger.
Yeah.
That really resonates for you now.
Yeah.
And when you bring up this memory, the doctor, how true do those words, I survived and I'm stronger, feel to you now 1 to 7? 1 false 7 true.
7.
So bring up those words, the memory and the words, I survived and I'm stronger, together, and follow. Okay. And when you bring up the memory, how true are the words, I survived and I'm stronger? 1 to 7, 1 false 7 true. Now.
It's a 7.
Okay, if I can ask you to close your eyes and bring up the memory of the doctor and the words, I survived and I'm stronger. And scan your body and just let me know if there's any tightness or tension or unusual sensation. Okay.
No.
Okay, good. Let's just notice that.
No, I'm just really tired.
All right, yeah, some
And
wonderful,
exhausted.
some wonderful work and let go of a lot.
Yeah.
And to me, when there's just the tired and exhausted after a session, it's really a good indication that something indeed has processed and integrated, and there's been this tremendous relief and release of energy. But, right. So,
Thank you for everything.
yeah, that was just an honor to be with you processing this.
Same wise. Thank you, Roger.